I'm Dr. Little. I'm the medical director at Sky. We see quite a few spinal cord injured patients. The spinal cord injury is an injury to the cord itself, not just to the bone. And when it's to the cord, you get weakness, you get some sensory changes, you can get some pain, and you can get some loss of your bowel and bladder function. And we see all kinds of combinations. By far the most common in our patient population is an older patient whose spine degenerates, and then they develop pressure on their cord, and a surgeon has to go in and relieve the pressure. Sometimes they're quite a bit better after surgery. Sometimes they're a little worse because they actually get some edema, some swelling following the surgery, and it takes a while to snap back. Well, our physical therapist will work on strengthening of the arms and legs and the walking. Our occupational therapist will work on dressing, eating, personal hygiene, bathing, and all the skills that you sometimes lose from weakness. And we have sometimes a need for either psychological support or neuropsychological support so that that patient's depression and some of the other things that go along with this doesn't get the best of them.